A baby getting a virus, there's more of a risk of it spreading to the bloodstream or to the brain. People automatically think a high fever is going to harm the body, but fever is the body's mechanism of fighting something. And some children can mount really high fevers of 104, 105. And so one of the biggest things is the sound can help us determine whether it's croup or wheezing. Wheezing is the lungs. So with every breath, you are hearing like a sound.
With babies, should we be keeping them away from visiting relatives or other kids in the family maybe that often bring germs in, or is that being too overprotective?
I will have that happen versus the risk of getting illnesses for my kid. Now, things that we can do there is
Today on Parent Unplugged, I'm joined by Dr. Mona Amin, a pediatrician and the creator of the hugely popular Instagram account at peds.talk, where she shares trusted advice with over 1.3 million parents. She's passionate about helping parents feel calmer and more confident when it comes to their children's health. And since most of us have turned to Google at some point in the middle of the night worrying about our child, I thought we'd get straight into answering the top health questions every parent has been searching for. It is a pleasure to have you here on the podcast today. Thank you for joining me.
Thank you for having me. I'm so excited to go over these awesome questions and concerns because that's what I do on my platform. So happy to be here today.
Brilliant. Okay, so can you start off by telling us a little bit about your journey and what led you into pediatrics and why you started at peds.talk?
Yeah, so I always knew that I wanted to do something in a helper field. I had a mom or have a mom who worked in healthcare, and I would visit her during the summers, work in her hospital, and I enjoyed it. I just loved the helper role of being in healthcare. So I knew healthcare was my calling, but I didn't know exactly what. And then I just loved the relationship I had with my childhood doctor. He was a family medicine doctor in the States, which means seeing children and adults. I loved the way he approached situations I had. I loved how straightforward he was. And I just figured, medicine is something that I'd wanted to do. And I always just loved going upstream. A lot of adults have issues in terms of like problems that they can't fix because of, old habits dying hard. But with children, you can have almost a clean slate, almost a foundation of healthy life choices. So I loved being able to go upstream into childhood, parenting, development, health, all of that. And in terms of starting Peds Doc Talk, I was working clinically and I was starting to get burnt out. And I had only been out of residency for 4 years. And I was like, this can't be my reality. Like, I can't be burning out and I still have a whole career to go. So I honestly turned to social media as a way of reclaiming my burnout. I wanted to reclaim the joy that I used to have with medicine by talking, explaining, having people ask questions, having more time, if you will, to answer those questions. And then I would start directing my patients to that content as well for supplementary information. And it turned out to be this amazing platform. Now I have my own podcast, YouTube, I have Instagram, TikTok, and it's given me so many opportunities that I never would have thought of as someone going through residency in pediatric medicine here in the States.
Wow, that's an incredible story. And you're right, it is an incredible platform that is beneficial to so many parents. I mean, 1.3 million followers of parents out there that you are helping with the content that you're posting, I think is incredible.
And it's awesome because, obviously in my head, I'm like, okay, I'm going to speak to my patients, meaning to people in the United States who have this information. But now I get people from all over the world. I have people in Zimbabwe, people in Europe, people all over that are like, thank you so much for the work that you do. And it means so much, to be able to reach people outside of the walls of an office, and have even further reach. So I look at it with so much gratitude. Every follower, every time I reach a metric milestone in the social media world, I don't look at it as anything more than just how awesome it is to reach so many more ears and so many more views, so that people can feel supported in this very scary journey of parenting that I'm hoping I can make feel less scary and provide more confidence.
And that's incredible. And I think your gratitude for that is phenomenal because parenting is scary, isn't it? Especially when it comes to health. I think we're not trained doctors. We're just parents. And it's the first time we've ever played in this role. So knowing what to do sometimes can be really daunting. So that kind of leads me on to the first question, which is one of the top things that parents do Google and worry about is coughs because children seem to have them so often. So do you have any words of advice of what actually helps with a regular cough and what we can do?
Yeah, I mean, of course, every one of these topics, I think we could even do like a super, super deep dive. And just as a disclaimer, on my YouTube channel, I actually deep dive into like all
Mhm.
common health questions. So you're going to get like the basic stuff here. So, in terms of what helps a cough, hydration, hydration, hydration. I think it's really important for your listeners to just know the basics here that when you get a cough, you have a bunch of cough triggers that go down your respiratory tract, right? So it could go down your throat, your trachea. And so phlegm, irritants in the environment, that's what triggers us to cough because it triggers a cough receptor. So keeping yourself hydrated, keeping your baby hydrated or your child is going to help moisten those airways, moisten everywhere that could be triggered by a cough. Now, honey is another awesome remedy. If your child is over one, it's one of the best medications, I'm putting that in quotes, that you can give your child. It acts as a cough suppressant. It acts as a
Mhm.
coating of the throat so that you're not getting those coughing fits as much as you would if you didn't take it. Adding
Mhm.
a humidifier adds to that concept of moistened air can lead to less irritation, right? Think about the last time you had a dry throat on an airplane. It's going to
Mhm.
trigger that cough trigger, right? On those receptors. So you want to keep things moist, humidity, all help, and then rest. We forget the basics here. I always tell my families, there's always a market for health. You can skip all the cough syrups, especially for young children. I personally don't give my children cough syrups. I think honey is even better, and I swear by golden milk, haldi doodh. It's like a Ayurvedic remedy, which is basically warm milk, honey, turmeric, black pepper, and then you can spice it up with some cayenne and cinnamon. It is my go-to home remedy when I'm
Really?
sick and when
Yeah.
my kids are sick. And you can give that over one because it has
Mhm.
honey in it. But you're going to see a lot of the recommendations is supportive. It's not really medications. And of course, if your child is having difficulty breathing, persistent fever with a cough, that warrants an evaluation to make sure we're not dealing with like a pneumonia or something that may need antibiotics. But most times than not, more times than not, a cough is viral, and you want to just support it with the things I mentioned.
Okay. So just so we're clear for the listeners there, with the honey, how is best to give that to a child?
So obviously it's very viscous, right? It's very thick. So you could just put it on a spoon. And again, you're going to give it over 1 years of age. Under
Mhm.
one, there's a risk of botulism, which is a type of toxin the baby can't handle. But over one, go forth and go free. And you can put it on a spoon. And just have your baby take it. You can also try to put it in a syringe or a medicine cup if they like that. And sometimes for some kids, if it's new, it might be repetition, but honestly, it's yummy and it's sweet. So I
Mhm.
haven't had many parents tell me that their kids don't love it, but you might
Mhm.
have to do a little bit of trial and error for them to actually want to take it. And you can do it twice a day, definitely before they go to sleep, just to, again, help coat the throat, and just the natural antiviral, anti inflammatory properties can help nip that virus in the bud faster so that you can feel better faster.
Okay. And is there anything we can give to a child under one?
So under one, you're sticking to saline sprays, you're
Mhm.
sticking to the humidification, you're sticking with breast milk or formula. But unfortunately, there's not anything that we can give by mouth for cough. And it makes it really hard because I remember when my daughter had a cold at 4 months, you're doing a lot more supportive care, cuddling, all of that because they can't have as much relief as an older child.
Yeah, it becomes quite taxing on the parent, doesn't it?
Yes.
Kind of
Yeah.
maybe sitting upright with them at night. They get very bunged up very easily, don't they? And there's just not a lot you can do.
Yeah. And also they can't blow their nose. So like adding on like nasal bulb suctioning, I recommend just saline spray,
Mm.
squeeze it into the nostrils, get it more loose. And if their body can naturally let it go, great. If it won't, you can suction it out, use one of those, nasal tubing suctions
Yeah.
or just a bulb suction to really help alleviate that before sleep or before feeds. No need to go digging in there
Yeah.
randomly. It's just if it's bothering them.
Yeah. Okay, that's good advice. So, would you say that we really need to shield kids from germy places like soft plays in the winter and catching those bugs? Or is it a part of building immunity? Do we need to just expose them regardless?
I love this question, and I'm in the middle. I have two small children. They both go to school, so they're already getting germ exposure in school, and
Hmm.
so we use a risk reduction kind of philosophy here, where if we have something big coming up, like for example, we had the Indian holidays, Diwali and Navratri, which is very big for us in our culture. I didn't want my nanny to take my daughter to the play gym because more exposure to germy places means more risk and chance of getting illnesses, right?
Hmm.
And I just didn't want them to be sick for the events. Of course,
Yeah.
I can't control them getting sick in all these places, but my idea is the more germ exposure you do, the more likely you are to get germs. So it's really a personal approach. I think socialization is really important. I think getting out of your house is really important, and especially in the winter,
Hmm.
you can get cabin fever. So every parent is going to look at their personal threshold for risk, right?
Yeah.
Know that indoor play gyms are germy. There's no way around it. I mean, they
Yeah.
could be cleaning that thing every day, every hour, but the problem is they can't clean it after a child touches every item, right?
Yeah.
Like they just can't. So I go into those play gyms knowing that, you know what? They have fun. We don't have anything major coming along. So let's just go. Now, as
Hmm.
a pediatrician, I have the savvy of knowing what's circulating in my office and what's
Yeah.
circulating as viruses. So if I'm hearing like hand, foot, and mouth or something annoying is going around beyond the common cold, I may say, you know what, let's not go there because I don't want my kid to catch something. But it really comes down to personal level of risk. And that is why it's so personalized. Like you can't say no, you can't give like hard yes or no
Hmm.
because it may just depend on what you have going on. Is anyone else in the family immunocompromised? What is your threshold because of, whatever else is happening to make you have those decisions? But I'll be
Hmm.
honest, I take my kids to play gyms. One of our favorite places to go is an indoor play gym that my kids just always ask me to go to. And because it was the holiday, I said no. And now I'll probably take them in a couple weeks
Yeah.
because they've been nagging me to go to this thing.
Yeah,
And
that's the
it's
thing. They
fun.
love it, don't they? My kids, I've
Yeah.
got two very active boys, so they love a soft play. But I do try to avoid them often after we've had a bit of a bout of illness because I sometimes think I can't. I need a break myself,
Yes.
and I need to catch up and get some sleep. And otherwise, I find we'll often go straight back into picking something else up, and then it's exhausting.
I mean, my biggest advice here is if you like to protect everybody else, and it like makes me cringe as a mom and a pediatrician. If your child is acutely sick, and what I mean by that is that they are febrile, they have a fever, okay, or they are sick and not looking well. Like when they wake up, if they don't have a fever, but they're stuffy and they're just cranky pants,
Yeah,
don't take them to a play gym. Like
yeah,
that is when they're probably most contagious. And now you've spread the germ to other people. And the amount of like people I'll see in the community that's like, oh yeah, she woke up and we just took her to like the gymnastics class. And I'm like, oh my gosh. Like if it's optional, like you don't have to go to those things. Like rest. And your
yeah,
kid is telling you if they're unwell, like they're cranky, they're just not acting themselves. Rest. Like be home and be quiet. And then you can go all you want when you're feeling better. This
yeah.
is a way that we can reduce that spread so that we can actually enjoy it and maybe not get sick every time we go.
Yes, that would be great. With babies, should we be keeping them away from visiting relatives or other kids in the family maybe that often bring germs in, or is that being too overprotective?
I love this. And, it's so people are often surprised when they find out that I take a very central approach to this. Because like postpartum, especially, after you've had the baby, maybe you're healing. Socialization is very healthy, like I said, even before for the, going to play gyms. So maybe you are looking at, okay, I want people to visit because I want them to visit. I need people around me, and I will have that happen versus the risk of getting illnesses for my kid. Now, things that we can do there is precautions for the visitors. So laying down some rules that if the visitors are sick, right? A grown up should know if they're not feeling well. Like they should know the difference between allergies and a cold, right? So if they're not feeling good, whether it's a sore throat, body aches, they stay home. Now, if
Yeah,
it's someone that has to be there, like a nanny or like another caretaker, it's if they are feeling unwell, and especially if it's a young baby, like under 3 months, hand wash, mask if you're able to. There are precautions you can take to reduce that risk of spread of a respiratory virus, but it's not so much as like, you can't have any visitors, don't ever do anything. And
mhm,
then the other comment is, I don't appreciate people who are not the child's parents kissing babies.
mhm,
It's very cultural to want to kiss babies, and I understand that being Indian American, but you don't need to kiss the baby. Like you're
yeah,
not adding. You can hold them, you can coo from far away, but especially if you're not feeling good. And the
yeah,
problem is, many grown-ups don't do that. And that's not fair to the family, right? Like if growing, like I know if I'm not feeling good and I will tell my family or my friends or my patients, hey, I'm not feeling great. So I'm wearing a mask and I'm just going to wear gloves when I examine your kid because I have a little bit of a runny nose. And I do that. And I wouldn't go visit my friend who just had a baby. So we all need to do better about that, right? Know that the baby's not going anywhere. Like you're going to see them again. So heal, don't go there. And if you are sick and have to be there, don't kiss the baby, don't hold the baby, just look from afar and celebrate that baby in the arms of someone who's healthy.
Yeah, because if that baby under 3 months, like you say, or even slightly older, it can be really dangerous, can't it? Depending on what they pick
Yeah.
up, what you carry into the household unintentionally.
And also, it goes down to fever, right? Like a fever over 3 months doesn't automatically mean that they're going to fight it fine, right? Obviously, we know that fever can be harmful in even an older infant or even an adult, right? But under 3 months, fever is automatically a cause of higher concern. And that just has to do with anatomy. So, even if it's a virus, right? Like, even if you have a runny nose, a baby getting a virus, there's more of a risk of it spreading to the bloodstream or to the brain. So, that is why we get a little more concerned because even if you know you have a runny nose, we don't want that any of that virus or anything else causing more harm to that baby. So it comes down to like if they get a fever and sick, they may have more of a need of a workup in the hospital or they may need to stay longer for observation. So we're trying to reduce the chance of fever, to reduce the chance of needing to be in the hospital and, missing time away from home when I know how much we all just want to be home after delivering a baby.
Yeah, absolutely. So that was going to be my next question. When is a fever dangerous and when is it just the body doing its job?
I love this because I think sometimes parents get confused and they often worry. And so let's create some rules here so that people know exactly what they need to do. So under 3 months, I would say you should let your clinician know.
Hmm.
Obviously we can get more nitty gritty there, like under 1 month emergency, like a
Hmm.
fever is an emergency. 1 to 2 months is like a gray area of like, we need to know, but you could maybe go to the office and not in an emergency room. And then 2 to 3 months is like, we need to know, depending on how your kid's acting, will determine where your baby needs to go. But I say
Right.
under 3 months, let us know so that it gives you that ballpark. Now,
Hmm.
over 3 months, they maybe have had their vaccines, their immune system's developing. I want you to think about your big few things. So you're going to look at number one, uncomfortability of that child. So if a child is inconsolable, irritable and your comfort measures, cuddling, skin to skin is not helping, and you give paracetamol, acetaminophen, or ibuprofen, and it's not helping that discomfort, right? Depending on their age, you are going to want to get them checked out, right? So irritability, despite fever reducing medications. That is something we just want to check that kid out. Why are they so irritable? Are they acting okay? The next thing besides irritability is dehydration. So if they're formula fed or breastfed, if they're not taking liquids, not making wet diapers, we're going to want to know about that.
Hmm.
And then the third thing is difficulty breathing. We mentioned that before with like coughs, right? Like if there's fever plus a difficulty breathing, retractions, the nostrils flaring in and out rapidly, the ribs tugging in and out, we're also going to want to check that out. And then lastly, it's the fever persistence, meaning a fever for any more than 3 days. It doesn't mean that 4 days of fever is an emergency, but it just means we want to check in, right? We want to know, is that child comfortable? Is that child having any difficulty breathing? Is that child dehydrated? Because all of those things are what I'm looking at. And I want to give the example that my kid, so my son, when he gets sick when he was a toddler, he would get fevers that lasted anywhere from 5 to 8 days as a
Wow.
virus.
Okay.
So
Yeah.
if I use that advice of like, okay, day 3 of fever, you got to go, it's an emergency.
Mm.
I don't want parents to think day 4 is a horrible thing. It's just more, you want to have your radars up a little bit more to make sure that you're monitoring their comfortability, difficulty breathing, dehydration. But as a pediatrician, I'm watching those things for my kids and I don't take them in because I know, okay, 8 days of fever, my kid just spiked high and persistent. And that's just how his body responded. And then my daughter will get high fever for a couple days and then it would go away. And
Hmm.
every immune system's different in how they respond to viruses. And it could be a different response to the same virus. So it's very interesting. But those are general rules that apply to everybody that, is fighting illness.
Yeah, I get that. I've got three children of my own, and I find over the years you kind of learn how your child responds to things, and often your
Yeah.
child will become more prone to things. So you kind of know, even though they look quite poorly, like that's normal for them, and we'll be okay in another day or two, rather than having to call the doctor. Whereas maybe when they're under a year, you might have called the doctor a bit earlier, not kind of knowing them as well and how they respond quite yet.
Yeah, and one of the common things that, my son would spike 105 fevers, and I didn't even talk about that because I know people automatically think a high fever is going to harm the body, but like
Mhm.
you said at the beginning, fever is the body's mechanism of fighting something, and some children can mount really high fevers of 104, 105.
Mhm.
Now, in that situation, obviously that child is likely uncomfortable, so you're probably going to give them like a fever reducing medicine because they're uncomfortable, and we give medication for discomfort, not for numbers on thermometers. And so if that child is still uncomfortable after fever reducing medication and is now like at 103, 104, but still cranky, that's the child you're going to want to get seen. But how many times have I been in my office where a family will have running in with a kid with 105 and
Mhm.
the kid is looking cranky and irritable? I give them ibuprofen and they're so happy. And the parent's like, oh my gosh, like they're acting well. And I'm like, yeah, they just needed some medication, and
Yeah.
they're going to be great. And we give the guidance, and so it's
Mhm.
not necessarily like high fever is emergency, but of course you're going to watch those other things that I mentioned, whether
Mhm.
they have a 105 or whether they have like a 101. You're going to watch for
Okay.
those things.
So that's interesting. So it's not necessarily about the actual temperature. It's
No,
about whether the temperature persists after the medication and the other
correct.
behavior that goes alongside of it, like the crankiness.
Yeah, yeah, it's looking at the child's comfort and that
Mhm.
persistence exactly. And like when I give my kids meds, that's exactly what I'm looking at, right? Because they are usually cranky with fever, both my kids, right? And so I will give it for the discomfort, and then I'm looking at that. And so if they were a 105 for my son as an example, and he was still 104 an hour later, I'm now getting a little suspicious. And then I'm like, as Dr. Mona can do, I'll look in his ears, just to make sure it's not an ear infection. And that's happened sometimes where
Mhm.
if it's a high persistent fever, it could be something bacterial, right?
Mhm.
And so that is what you're looking at. And obviously, I don't expect everyone to have the tools at home to do that, but you do have your clinician. You do have the urgent cares, the ERs, the GP's office to be able to go to.
That's another
Yeah,
good point. What you said there, though, how often sometimes just that dose of Calpol or Nurofen will make a huge difference. I've had with my kids, you genuinely think they're really, really poorly, and I think we're definitely going to be going to the doctors today. And you give them that dose, and they are completely changed. They're playing, they're back up on their feet. But when that dose wears off, they'll go downhill again. It can really
correct.
make a huge difference.
It's liquid gold. We call it liquid gold in our house. Like it is like when my daughter wakes up from a nap and she's sick, right? And
Yeah.
like she's cranky, me and my husband look at each other and I'm like, should we give her some liquid gold? Like because of the crankiness, right?
Yeah.
And we know exactly what that means. And even our son will watch that happen and be like, oh, she's not feeling good. We're going to give her medicine. And even like, hear what I say, like, even though she may not have a fever, if my
Hmm.
daughter is sick or my son is sick and I know that they're sick because I've been wiping boogies all day, I'm
Hmm.
still giving them medicine if they're able to get it because of the spacing, because being sick hurts. Like
Hmm.
I think about like as an adult, I sometimes will take Motrin, which is ibuprofen here, when I have a headache or when I'm like achy, right? Because it's the feeling. And our children, especially the younger kids, like under 3, 4, they can't always tell us that they're feeling good and they're or not good, and they'll just cry. And
Hmm.
so that's kind of your personal gauge. And as long as you're not overdoing the dosing, like,
Hmm.
obviously with things like ibuprofen every 4 hours, acetaminophen, paracetamol every 6, as long as you're not like overdosing it like every 2 hours, you're not doing it wrong, right? Like you want to make sure that you're giving it as recommended on the packaging, but treat the symptoms, not the number, is that sort of bottom line for that kid over 3 months of age. And if you're
Hmm.
feeling like something's off and you don't know what's going on, better bet to just get them checked out.
Okay. So, chickenpox, is it better to vaccinate or let nature take its course?
Oh, so we all, I grew up in the 80s, where we all, I think, had chickenpox.
Hmm.
And so this is like survivor bias. And a lot of, people are like, well, I turned out fine. The thing about this is that I will always recommend the vaccine over natural immunity. And that's because I've seen the consequences of getting the chickenpox illness and the complications that can happen. And
Right.
when you start to see that, you can't imagine not doing the alternative, which is giving a vaccine that doesn't have that degree of complication, right? And I'm talking about the natural infection can lead to hearing loss, which is
Hmm.
one of the more common things. And also, it can lead to shingles later in life, which is, adults have this where a lot of us may have it when we get older, when times of stress or when you're immunocompromised, you get chickenpox virus that comes up on your skin. And that is really painful. And
Hmm.
so I know family members who have that because they had chickenpox illness when they were a kid, and it is not fun. And so my recommendation will always be to get the chickenpox vaccine
Hmm.
over chickenpox parties because the benefit of the vaccine far outweighs the risk of getting it, and when we talk about vaccines, that is how you should be positioned for education. We want
Hmm.
something where the benefits greatly outweigh risk. And in vaccines and the routine ones that are given in childhood, that is the situation here. That is there a risk of getting a vaccine? 100% there's a risk, right? Meaning we can't ever say that it's 100% safe,
Hmm.
but the risk is so small that I rather have someone get the vaccine with a small risk of maybe getting fever, maybe having an allergic reaction, which is so small, than actually getting the virus, having shingles, having hearing loss, which is what we see far more when someone gets natural infection.
Okay, that's really interesting because, yeah, people do talk about chickenpox parties, don't they? And I feel
Yes.
a lot of parents almost kind of pushing their children towards that because they want them to catch it and kind of get it over and done with.
And it is one of those things that, yes, when you get it as a child, it's over and done with until you become an adult. And
Hmm.
shingles, because I love to explain shingles because people don't realize that this is a huge burden. Like when you get chicken pox, it lives dormant, meaning it lives in your body. And that's really weird and scary, but it lives in your body. And then it becomes this, chicken pox shingles reaction during times of stress. And so you could have stress from work. Maybe you're a parent, whatever it is, or maybe you're a grown up, 65 plus and immunocompromised
Hmm.
because of age. And now you're starting to break out in these little chickenpox shingles virus, which is very, very painful. And so I don't want that. I don't think anyone wants that. And this vaccine prevents that from happening because you
Hmm.
can't get the virus in the first place to subsequently get the chickenpox
Wow.
and
Okay. I
disaster.
didn't know that.
Yeah.
Yeah. Yeah. Okay. Yeah. Big reason to vaccinate for sure. When should we worry about wheezing then or noisy breathing?
One of the biggest things here is little babies are going to make a lot of noise. So I always say, like, if they're sleeping comfortably, let them sleep. And that's the same motto for a older child as well.
Hmm.
Difficulty breathing will wake up a child. Obviously, like if they're wheezing, if they're in distress, you're going to wake up because you're going to start gasping for air, right? So if you're hearing the noise while they're sleeping, you can take it like a video of it. But when they're awake and you hear that sound and they're unable to speak, if they're speaking, if they're unable to get words out, if they just look tired, you're going to want to get that evaluated, right? And also, if people can't see, you're looking at the nostrils flaring in and out rapidly. You're looking between the ribs, tugging in and out rapidly, or the bone that lives right above the rib cage, your sternal notch. It's that little like cup thing that's right below your neck. It's like a little
Hmm.
U shape. If that's tugging in and out, that's a sign of distress, and you're going to want to get that evaluated.
Okay. And then how can we tell then if that is just a cough or a chest infection? I mean, obviously we'll take them to get them evaluated, but what's the difference between, I guess, a cough, a chest infection, croup? There's various different chest infections, aren't there?
Yeah. And so one of the biggest things is the sound can help us determine whether it's croup or wheezing. So croup is this sort of high pitched, what we call stridor. It's
Yeah.
almost like a barking seal, is how you would
Yeah.
describe it. So ooh, 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 like it's like a high pitched sort of squeak when they cough, when they maybe talk. That is croup. And that's an upper airway inflammation. And then
Hmm.
wheezing is the lungs. So with every breath, you are hearing like a sound. Both of them are often treated with steroids. The steroid choice depends on what it is, but both very often there's treated with steroids if it's significant enough. So either noise that you hear, if the child is in distress, you're going to want to get it checked out. It's not, I don't expect you to know the difference
Hmm.
between croup and wheezing until your child has actually had it. And then
Hmm.
in terms of knowing if whether it's a bacterial infection, it really comes down to that difficulty breathing and or fever involvement. A fever doesn't, you can still have a bacterial infection without a high fever, but more likely you're going to see fever. More likely you're going to see that tugging in and out of the rib cage, right? That is
Hmm.
a red flag that let's go get them evaluated. And what we would do is listen with our stethoscope. We may even do some imaging depending on where you're at, to look at the lung fields, just to get a better idea of what's going on.
Okay, fabulous. So why do we always feel though like our kids always have a cold? Is that normal?
It is normal. And there's a few reasons. One, especially under the age, and I'm going to use the age of, let's say, 7, okay? Under the age of 7, your children's immune system is really developing, right? Meaning their body has never been exposed to all the viruses out there. I mean, there are hundreds of viruses, and then every virus has different variations. So that's why we, as adults, even can get sick again, right? Because
Yeah,
the common cold has different variants, right? And so you have a child whose body is immune and learning about all these new viruses, and they now have to figure out how to fight this stuff, right? And
mhm,
then you have hygiene. Kids are not the cleanest. I mean, let's be honest, they are gross and nasty, and that's just what they are until they learn hygiene. So
yeah,
until they learn how to wash their hands, and that washing hands is important, and that we don't stick our fingers in our nose or mouth after touching something. But just
yeah.
because of development, that's not something that's common. And that's why it's so important to make that a non-negotiable boundary in your house, that hey, before we eat, you have to wash your hands. Like, that's how our house is. And my son will like pout and scream sometimes when he was younger, but we're like, sorry kid, like if you want to eat your snack, you're going to have to wash your hands, right?
Right.
Like when it's done. So make it a non-negotiable. But it's the fact that their immune systems are immature. And then it's the fact that when you put all these kids together, they're sneezing, they don't cover their mouth, and now germs are flying wild. And so they just have just sheer exposure. But it
Mhm.
does get better as their immune system learns, like, okay, well, I've seen this virus before. Let's fight it faster. So maybe you won't have that kid getting sick every week or 2 weeks. You might have that kid now getting sick every few months. Or when they get sick, maybe they just feel a little achy, like me and you would. And then some rest and hydration make them feel better because it's their immune system in training and working hard.
Okay. So another one though is COVID, and that now just feels like another type of flu. Should we even bother testing for it anymore? Does that make a difference?
So there's a lot of controversy around that question. You will ask people who will say, oh my God, yes, I do test because I'm curious. When I
Hmm.
have a virus that feels weird, like meaning like is unusual for me, I'm like, is this COVID? Like, what the heck is this virus?
Yeah.
And many times it's negative. Like it's just some other virus that we can't test for. So the recommendation from my end, and I want to be clear that this is taking official guidance and my own personal opinion as well. Okay. I want to be very transparent about that. I would test, especially if you're going to be around vulnerable people, meaning because we can test, testing for flu, testing for COVID, useful if you're going to be around someone who's immunocompromised,
Hmm.
because it can help you add more layers of protection for that person. So I'm talking maybe a newborn, grandpa, someone who's undergoing chemotherapy. Like, think about who you're going to be around, right?
Hmm.
If you aren't testing and you're sick, whether it's COVID or not, I highly recommend masking, because masking can reduce the spread. And that's what I do. So, for example, I don't mask when I'm healthy on flights, but I always take one because the other time I was sick with COVID and I got it on a trip. And so I wore a mask on the flight back because I'm just trying to protect the people around me. I'm
Hmm.
not going to, I can't not fly, but I want to not spread my germs to everybody else. So that is kind of my balance of being a good steward and
Hmm.
not worrying so much about, okay, well, the test is negative, because could there be false negatives? Yeah, maybe you have it and is testing normal. But what we can do is, if we're feeling unwell,
Hmm.
mask, hand hygiene to protect the greater good, and stay home if you're really unwell, so that you cannot spread your germs to other people.
Yeah, I think you're right there, though. It is about the people you're surrounding yourself with, isn't it? So if that is
Yeah.
going to be a newborn baby or maybe grandpa, then just being that little bit more considerate.
Yeah, and like in my office, like I wear a mask still for every sick visit because I don't want to get their germs, like hands down. And then I wear it with whenever I'm feeling unwell, and I have enough insight to know when I'm feeling unwell. Like you're achy, you're tired, or maybe you have a sore throat, and I will wear a mask in those visits that I'm healthy enough to go to work, but I don't
Mhm.
feel completely 100%. And I'll wear a mask when I'm not feeling good. So that is just how I approach it. And some people do something different. Some clinicians are like masking on every flight, or they're masking on every visit. And
Mhm.
I just kind of look at, okay, I'm feeling good. I know when I'm not feeling good because I have really good insight into my body. And that's how I approach it. And that's why I said it's such a controversial response. But I believe that mine adds a little bit balance here, where we protect others, but also can, ditch the mask when we feel it's not needed.
Okay, great
Yeah.
advice there. So, what's the real story on vaccines? Which fears and myths can parents let go of?
Ooh, this could be a book I should probably write. I think one of the biggest things is I said it already is understanding that the benefits outweigh risk is 100%, and the myth of them not being tested or studied. Like
Hmm.
I want to explain, like in order for something to come on the market, it's years of studying. I know this because I've learned about the Beyfortus, which is the RSV antibody for babies. I'm not sure if y'all have that where you're at. It's the to protect against RSV, like severe complications from RSV. And it's been in the United States for like 2 years now, and
Okay.
it took 7 years of development. It's not
Hmm.
something that they just think of one day and they're like, oh, you know what? Let's just put this on the market. The
Hmm.
level of research that goes behind vaccines is very significant, and it's tested. And there's a lot of controversy right now of like, oh, but it's not tested against placebo, or the testing is not what we want. There's current guidelines that make sense for what you can test, how you test vaccines to be ethical. And so I know this, that it's tested. I also want to reassure a lot of listeners that as a practicing pediatrician, I'm also giving this vaccine not only to my children, myself, and my patients, but I'm also looking at patterns. Like if I saw a vaccine causing a problem in my patients,
Hmm.
I would sound the alarm, and all of us would. This is not something that we would hide because our duty is to our patients, right? Is to make sure that they're safe. And I want to use this example that in train when I first left my job or my residency, I was at a job, and there was a handful of family of children who were getting febrile seizures, which means fever seizures after the DTaP vaccine. And
Hmm.
our practice noticed this because one of it happened, and then another one happened, and then another one. And we're like, what is going on? And we did an investigation. We found out that there was a lot of this vaccine that was increasing the risk of febrile seizure. Contacted the manufacturer. They pulled it from the market. Those children made amazing recoveries because febrile seizure is not a long-term complication. And we handled it because we saw that there was a pattern of only 5 children, but it's not something we wanted to see because we're like, hey, that's like a lot from one office that was happening. And so we are always doing checks and balances. We care so deeply about the health and safety of children. So not only is that happening from the research side, it's happening from the clinician side. So when your clinician is saying, I believe in this vaccine, I believe that benefits outweigh risk, it's because they probably have seen what I see, is that the actual illness is causing more harm than the vaccine ever would.
Okay, okay, that's really interesting, really interesting. So, Mona, Dr. Mona, please, have you got any last final words of advice for the listeners today?
Oh, I love this conversation. I know we talk so much about health, and it's so important. I think it's so important when you are looking at your child's health in general. So maybe you are listening to this and you've had a kid who's been sick on and off, or you are worried about the advice out there. Always look at the big picture for your child's health, right? It's so easy to get lost in the minutia. It's so easy to think when your kid is sick, what did I do wrong? What's going to happen? You got to look at the kid in front of you. You got to look at what you're going to do now, how you're going to get through this storm of being sick, rather than thinking about the shoulda, coulda, woulda, because that's just not going to help anyone in that situation.
Hmm.
Be hopeful when your child is sick. I cannot stress this enough. When you're negative and spiraling into that negativity trap, it doesn't help anyone. Hope is not going to heal, but hope is definitely not going to hurt. And I see this so strongly. When my kids get sick, if I am negative and like, oh my God, it just doesn't help anyone. But when I'm like, you know what, we're going to handle this. I have my stuff. I know what to do if my kid is sick. I know that I can reach out to a colleague and go get them evaluated. You have control. You have a plan. And that's what I want you to have. And the second comment is when you're getting advice about vaccines, about your health, make sure they're people who understand both sides. Maybe they have been a patient, maybe they have been a clinician. Don't get your advice from people who are selling supplements, who have a hidden agenda. It's really important when it comes to health to find people that you trust. Hopefully, I can be one of them, and really,
Absolutely.
really go with that information to make the best decision for your child. Because, like I said at the beginning, this is about being a confident parent. Because when you're confident, you're more likely to be confident in your decisions as well as a parent as well.
Amazing. Mona, you've given us so much useful advice there. I think from coughs and colds to fevers, COVID, how to handle vaccines, chickenpox. There's so much content there for the listeners to take away with them,
Yeah.
for anything that they could be worried about with their children. So thank you so much for your time today. I really appreciate it.
You are so welcome. It was such a pleasure.